Assalamu alaikum dear students, it's Dr. Masuma Mehtab. So today topic of discussion is breast examination. So let's go. The breast, as we know, is also called as mammary gland, which is a modified sweat gland. It's located between the second and the sixth rib. It starts from the second up to the sixth rib. There is no any muscle in the breast. However, there are some muscle that underneath the breast tissue. They are pectoralis major muscle and the pectoralis minor muscle. So here you can see the pectoralis major muscle as it's occupy the larger area, and that's why it's called as major muscle, and pectoralis minor muscle underneath the breast tissues, right? Okay, as I have told you, it starts from the second and ends at the sixth rib. Okay, so come to the anatomy. It comprises of lobes, lobules, lactiferous ducts, lactiferous sacs, and nipples, and areola as well. Okay, now here you can see, here we have lobule. All of these lobule are combinedly called as lobe. Now these lobes are separated by means of a fibrous septa. Now here you can see the lobules are connected by means of duct, and here the duct is called as lactiferous duct. Here is labeling as well. So here you can see the duct, and then we have here lactiferous sac, and it opens into nipple and areola, right? Okay, so this is anatomical division. This is we are actually dividing anatomically the breast into four quadrants. This is upper inner, lower inner, and lower outer and upper outer. And this is the tail, which is called as axillary tail because it joins the axilla, right? Okay. Then the most important thing is lymphatic drainage. We have certain lymph nodes in the axillary region. Those are lateral lymph nodes, central lymph nodes, apical lymph nodes, anterior and posterior lymph nodes. Okay. Now come to the main topic, which is examination of breast. Initially, we know we have to introduce ourselves and then take the permission of the patient, which is called as consent, and then position. Position is somewhat important in palpation and inspection. We'll discuss later. And then exposure, inspection, palpation of breast tissues, palpation of axillary lymph nodes. Okay, starting as we have discussed the introduction and consent. So that's why I'm starting from the position. So inspection can be done in four main positions. In the standing, sitting, leaning forward, or which is also called as bending forward, and semi-recumbent position. Okay, starting from the inspection, inspect all the structures of both breast and look for. Now you have here compare the both breasts, right? In inspection, you have to compare the both breasts. Now look for the symmetry of breast. Whether the breasts are symmetrical or not, then go for the size. Look for the size of both breast and compare. And then look for the texture, if it appears soft or it appears hard. Now, as we know, in the case of inspection, we have nothing to do with the palpation or touching the patient. Only we have to inspect. Only we have to see the patient. Only we have to see the pathological condition of the patient without touching, right? And then we have skin of the breast. So the skin and the color of breast is important itself because it gives a clue about inflammation, like in the case of abscesses or ulcers, right? Okay, and then any ulceration in the breast. If you find any ulcer, then you have to look for the margins of the ulcer and the base of the ulcer. Okay, and then any fungating mass. The fungating mass is basically a clue about malignancy, right? Okay, and then any visible mass, pudgy orange appearance, I'll discuss it later, and then any nodule. So you have to inspect all of these 9 things, right? Okay, now this is the pudgy orange. As the name suggests, it appears like a peel of orange. Now this condition happens in the case of whenever there is a lymphatic blockage, and the lymphatic blockage is mostly occurs in the case of carcinomas. So this is a carcinomic condition. Okay, now after inspecting the breast tissues, now we have to go for inspection of the nipple. So initially you have to see any discharge. As you cannot touch the patient, you can request the patient to squeeze her or his nipples. We're looking out any kind of discharge like pus, blood, watery or milky discharge. And then you have to look for the shape of the nipple. As it can be everted, it can be inverted. Now here the everted is the normal shape of the nipple. Inverted is due to fibrosis of the nipple, or that leads to attachment of the nipple to the underlying tissues. And this is very common in malignancy. And then you have to go for the color of nipple. Now here we have two normal colors, pink, which is very common in young females, and brown, or yes, brown or dark brown. Now this brown and dark brown is very common in old females or the pregnant women. Both of the colors are normal, right? Okay, then after that we have to inspect the areola. So you have to look for Montgomery's glands, which becomes enlarged in pregnancy and called as Montgomery's tubercles, and the color of areola. Now here you have completed, no, then we have to go for the inspection of lymph nodes, right? So look for axillary lymph nodes and it's not sub, it's supraclavicular lymph nodes. Okay. Now the lymph nodes in the axillary region and supraclavicular lymph nodes. Now they are seen in this position, right? When the arms are raised above the head. Okay, now this position is bending forward. Now this position is mostly used in the case of finding out the nipples, whether it's everted or inverted, whether it's fibrosed or not, right? And this hands on hips will lead to visualize any kind of mass which is present inside, it will be visualized. Okay, now this is a normal position, you can inspect in this position as well. Okay, now then we have palpation. Now palpation is done in sitting and semi-recumbent position at 45 degree, right? Okay, so the palpation, we have to palpate all of the four quadrants, but in a manner like from outer upper to outer lower quadrant, and then inner lower quadrant to inner upper quadrant. Now here you can see upper outer quadrant and lower outer, and then lower inner quadrant, and then upper inner quadrant. Now we have two methods of palpation. One is a superficial palpation and the deep palpation. So you have to palpate superficially with the palmar surface of hand in this direction, and then you have to go for the deep palpation in this direction as well, right? Okay. Now if you do not find any kind of lump, then the examination is done here. But if you find any kind of lump, then you have to go for the temperature. You have to check the temperature of both of the breast, especially at the site of the lump. But initially you have to palpate or look for the temperature of the normal breast, right? Okay, then you have to see for any tenderness in the lump. Then where this lump is located, you have to mention this, and the size of the lump, shape of the lump, number of the lumps, and surface. Now number of lump, like how many lumps are present, right? Like we have 1, 2, or 3 multiple lumps can be present in the same breast. Now this indicates fibroadenoma because it's multiple in nature. However, the surface, it gives clue about the malignancy or benign condition, right? So if you find any surface which is even, regular, so it's mostly due to benign condition. However, if you find irregular surface of the lump or uneven surface, that indicates malignancy, right? Okay, then you have to look for the consistency, if it's hard, firm, or stony hard, and then mobility. The fibroadenomas are mobile in nature, which is a benign tumor, and the carcinomic are not mobile. And then you have to see the skin attachment. Pinch out the skin and you will see any attachment of the lump within the skin. Okay, so in the benign condition, we have other benign conditions, but most commonly in young females, unmarried females, we have fibroadenomas. They are even in regular surface, very mobile, no attachment with the skin, and multiple in number. But if it's carcinoma, so the surface will be irregular, there will be underlying attachment, highly defined margins, and no mobility at all. Discoloration of overlying skin, discharge from the nipple, which will mostly be bloody discharge, and axillary lymph nodes enlargement, which is the main point here. So this is a way of finding out the enlargement of the lymph nodes, and if you find out the enlarged lymph node, it indicates malignancy. Go for the supraclavicular lymph palpation as well. And if you are done with this, you have to go for the palpation of other organs because